Hi, everyone. Welcome to the November 4th briefing. I can't believe we're already in November here. Time is flying by. We'll start like we normally do with the numbers. We're at 11,564 as of Tuesday. That's plus 75. Monday at a plus 33, and Sunday a plus 43, which is pretty stable for what we've been doing in the past. We're at 161 deaths. No new deaths report this week thus far. The numbers, as we look at the positive cases, more than half are the Latinx, which is still disturbing. It's something that we're really trying to get a handle on and focusing on. And we really have a great amount of beds available. This is probably the lowest amount of hospitalizations we've seen in a long time. It's 17. Maybe since we started. Over 210,000 tested now in this county. That's an incredible number. So a couple of changes. Last Friday, the health officer, Dr. Scott Morrow, issued a revision to 2 health orders. One, revising the visitation guidelines for long-term congregate care facilities to allow indoor visits for compassionate care. And 2, aligning local health orders with new CDC guidance regarding quarantine and isolation. The county mobile and stationary testing, an incredible almost 7,100 tests last week, 3,100 at the event center, 2,300 mobile, another 1,500 from curative drive-through at the event center. And again, that's that family lane where kids 5 years or older can drive through with their parents and get tested. And that seems to be working very well now that we got the word out on that. So we'll continue to put that information out there. Testing updates, we continue to increase testing in the county. And this is incredible. Since September, when we went on, really that we put in place that process to increase testing because we knew it would have an impact, number one, on determining who out there is ill and getting us ahead of the contract tracers, but 2, have an impact on our case rate, the way it was looked at by the state in regard to the tiers. We have increased our testing over 100%. We were at 230 tests per 100,000 back in September. We're now approaching 500 at 472 per 100. This is an incredible expansion. We want to encourage people because this is impacting. In fact, we're almost maxed out on the benefit we get out of testing. We're doing so well in that regard for its impact on the case rate. We're almost maxed out on that, but so we need to encourage people to keep getting tested. I got to tell you that this is even in regard to the significant expansion of testing volume that wasn't counted by the state. And there was a reporting error that would have allowed us probably to move through the tiers quicker, but the state is working on this, and it really had to do with information being sent to a lab that was not being reported to the state, so it was not counting towards our testing. So the bottom line is our testing volume is strong right now. The state's working on correcting that, and we're doing well, and we want to encourage people to keep getting tested. In addition to large-scale community testing, we continue to work with the cities and local CBOs to host neighborhood testing, and that's working out really well too. The partnerships with Curative are going well, and we have begun to rotate mobile curative testing vans to at-risk neighborhoods across the county. So before we had beta tested the curative mobile van, now we will have them out in a regular cadence in neighborhoods that are vulnerable. And they'll be staffed by curative employees with the help, and will certainly help us to continue to lower barriers to access during the testing communities, to these testing communities. And that's so important. We want to get these testing sites to really where we're having and seeing some problems, and we'll continue to work on that and provide access to everyone. The blueprint to a safer economy. The state just released their numbers today for this week. We're still in the orange. This is our second week in the orange. We are at 2.9, so we came down a little bit on the case rate, and that was because of that tremendous testing. We were at 5.7 unadjusted, so that testing is really helping us out, and that's why I'm stressing it's been so important to us. Positivity rate is at 1.6, and our equity measurement went up just slightly, I believe, to 3.9. So we're still doing well there, and you know, this really is part of all that overall strategy of making sure that we wear a mask, get tested, socially distance, and continue to wash our hands. So that is all good news on that front. The COVID-19 compliance team, they've engaged, the engagement team has been out to 65 businesses, doing a great job, and they're out there really working with the owners and employees of those businesses, letting them know how to be safe and some of the tools that they have to help them be safe and protect their customers. The compliance team is out there visiting businesses also. Thus far, we've had 200 complaints have been received and 212 sites were visited. We will be focusing on indoor activity to make sure that that all the regulations are being adhered to. So our COVID-19 compliance team will be out there really looking at those businesses that are open indoors and making sure that all of, as they expand, like restaurants, for example, for 50%, gyms to 25%, and department stores, we want to make sure that those safeguards are still in place and that those regulations are still being adhered to. The highest number of complaints are in San Mateo, Redwood City, Daly City, and South San Francisco. No surprise, they're the big cities that we have. Most common type of business to receive complaints, restaurant, bars, fitness centers. Most common types of violations are not wearing masks and taking steps to ensure social distancing. So 55 allegation letters have been sent out, and we will continue to work with those businesses. County assistance update, we have 182 total homeless being served right now in our motels. Project Home Key, as you well know, the state granted us $33 million. That's not what it will take to purchase 2 hotels, but that was a large chunk of what it will take to purchase 2 hotels, and we will come up with the rest of the money to purchase those two hotels. The funding to be used to purchase 2 properties totals really 170 rooms. So 95 at one hotel, and that hotel will be in Redwood Shores and will be converted immediately to senior low-income housing, which is unbelievable. Each unit has its own kitchen and will immediately be permanent housing for seniors. Think about typically how long it would take us to build 95 units of senior housing, from purchasing the land to getting the permits to then the building, 3 to 5 years. And here we have almost a turnkey operation that will serve our seniors in this community. And we are one of the fastest growing or aging populations in the state. So this will come in very handy. The other hotel will be our supported services hotel with 75 rooms at that location. The Great Plates program, which really quickly served 3,062 participants as of right now, a staggering almost 850,000 meals served. What an incredible program that has been. Small Property Owner Assistance Program is continuing to take applications to its extended deadline of Tuesday, November 10th. To help residents fully complete the application process, staff has prepared an application checklist, and that can be found at SMC Strong Fund website. The San Mateo County Small Business Relief Fund. This is the Renaissance Entrepreneur Center. Is really up and running in full swing. This Renaissance Entrepreneurship continues to provide grants to small business owners who reside in the targeted areas of EPA, Tacoma, Daly City, Menlo Park, Unincorporated, Midcoast, Pescadero, Redwood City, North Rogue, San Mateo, and South San Francisco, and San Bruno, who are lower income and have been directly and adversely impacted by the pandemic. To date, we've received 27 applications. We've fulfilled 7 of those so far. And we've got more room in there. So we're highly encouraging people to apply for that. And last but not least, the mask mobile, which I saw go by the county center earlier today, distributed last week 527 masks. To date, they've distributed 13,000 masks. And this is the schedule of where they will be. Do have a question from Sierra. I figured, let's see. How much does the county spend on hoteling the unsheltered? I can tell you a lot of money. It's costing us almost $1 million a month to house the homeless. It is money well spent, though. Many of these seniors are vulnerable and would be highly susceptible to COVID-19 if in a congregate setting. And that was why the strategy of trying to buy hotels is so important. We are not going to be able to sustain that as the room key program winds down. We would not be able to sustain that for an ongoing basis. It's actually less expensive for us to purchase these hotels and permanently have those locations for folks. We will be looking at other opportunities that may arise in the future to purchase additional rooms, and we'll keep you posted on that. Yeah, I'll give you where the properties are located. We're having a special study session, a special board meeting tomorrow to approve the acceptance of the grant and ratify the contract with the two hotels. One is the Town Place Suites in Redwood Shores, and the other one is the Pacific Inn in Redwood City. And that board package should be out now, I believe, or just very shortly. And that'll be that special board meeting will be at 2 o'clock tomorrow. With that, I am happy to entertain any questions you might have.
We do have one question in the chat at the moment. How much money is allocated for the Small Business Relief Fund?
I believe we have
2.5 million.
I think we have at least $1 million, potentially 2.5. We have a good amount of money there, so we've got a lot of capacity there. I think we just allocated some more to that, and we're checking on that as we speak.
Great. Sarah Wright, if you'd like to unmute yourself and ask your questions.
Hi, thanks so much. Can you elaborate on the lab results you said weren't processed by the state? Is that a specific lab in terms of it was coming from a specific testing site, or do you have any details on which tests weren't given to the state?
You know, we believe that there was a hiccup in the system. As you remember, way back when there was a backlog of cases being through Verily. They went to an additional lab. That lab was approved by the state, but not directly connected to the state as far as reporting. And therein lied the hiccup, which prevented us from realizing the full value of the tests that were being conducted in the county.
Got it. And then going to the COVID compliance team, is there a list you can provide, or if I could reach out to Michelle to get a list of businesses you all have been working with, or a list that defines geographical areas of how many folks you've been working with in each city?
Well, there's two different groups. One's the compliance unit and one is the outreach unit. And the outreach unit is specifically targeting those low-income businesses that may need resources. And we're working with them to make sure that they understand what the regulations are and make sure that they have the resources necessary to comply with the law and stay open. And then the compliance unit, we wouldn't give out the locations. A lot of these really are just educational opportunities. If we do cite somebody, we'll certainly probably make that available. I think that everyone would want to stay off that list. Our goal is to not cite anybody, though. We really want to work with these businesses to stay open and comply so that we can safeguard the safety of not only their employees, but the customers. And move through the tiers and at least stay where we're at and potentially move to yellow. We just don't want to go back. We don't want to see a problem with these locations where COVID-19 starts to spread, and we have to, it causes us to revert backwards.
Got it. Thank you.
You're most welcome. And we have confirmed 2.5 million to the small businesses so far.
We did have a follow-up to the small business question in regards to where is the money coming from for that program?
Yeah, it's coming from CARES funding.
Sierra Lopez.
Sierra, how are you?
I'm good. How are you?
Good.
Awesome. I had a follow-up to Sarah's question about the reporting error. When did the county learn of the reporting error, and for how long were those tests not being, translated to the state?
Sarija, you might have some more information on that that's more specific.
There actually is information posted on the state's website, the CDPH website. It's a formal process called adjudication. And it was about 3 weeks ago in which some of the anomalies of what the state was crediting and what our internal numbers were showing became known to us, and initiated the process and working with the state and tracking back on what results were not being credited in what was showing up in the state system.
And yeah.
Okay. And then, Sarija, I have another question for you, actually. We know that the cases that were being reported in North Fair Oaks were potentially being listed in other neighboring cities. It looks like now there's additional cases in that community. Are those new cases, or has that reporting error been fixed?
Yeah, let me clarify, and thanks for giving me that chance. Basically, the cumulative cases were not all attributed correctly within the sub-geographic areas that were showing on the dashboard of the cases by city. And last Friday, in the weekly update of cases by city, that reflected an improvement in the geocoding that was used, so that any cases that might have been attributed to Redwood City instead of North Fair Oaks, or to a city whose boundaries share a zip code, could be corrected. It was caught up to be the same cases, but reallocated to be more accurate. And that's not new information as to all of the mitigations we've put in place, all of the testing we've mobilized. We've always used the most finely grained geocoding analysis to help mitigate, but that dashboard didn't have that extra level of precision.
Got it. So then that wasn't a flare-up. Those cases were just being properly attributed.
Correct. And then it was properly attributed through the cumulative total. So we wouldn't want anyone to be alarmed that when the North Fair Oaks number, for example, which is the one I think that was cited in the San Mateo Daily Journal, went from fewer than 10 to 551. That's correcting for the many weeks and months of the pandemic, so that any case that might have showed up in Redwood City or Menlo Park rather than North Fair Oaks got accurately attributed to North Fair Oaks.
Thank you so much. I do have one more question. This might be for Mike. We know that San Francisco and Alameda County have begun severing ties with Verily over data privacy concerns, and a concern that the service is benefiting higher income communities rather than low income Black and Latino communities. Is this a concern shared by the county? And has there been considerations for utilizing an alternative provider, potentially Curative or any others?
Yeah, you know how we addressed this, Sierra, and we were, I think, the first to do this was to get Verily to make sure that they go around to the areas where they were most vulnerable. So we didn't keep the stationary site at the event center, but we rather brought Verily into those neighborhoods we were most concerned about to make sure that we had equal access opportunities for everyone. And that has, been something that we've maintained with Verily. We didn't want to have a situation where we just had it at one location, the San Mateo, where people had to come from Daly City, East Palo Alto, and that's why we're doing that. Additionally, we're doing the neighborhood testing, and now with Curative, we're in the mobile van testing in these most vulnerable communities to make sure that we can get down to neighborhoods where we want. So we're feeling really good about the way we're testing right now and the fact that we're spreading testing throughout the county and giving equal access to everyone. And we think that that's certainly paying off in the numbers that we're seeing that are being tested. And I think that probably differentiates us from others who have used Verily.
So then can you elaborate then on where the county stands with the data protection and privacy aspect?
Well, David, I don't know if you know more about how it's being used. I don't know how it's being used or if it's in fact being used or if there's just a worry about it being used.
He does not appear to be on the call at this time.
David is not on the call. We may have to, Sarah, we may have to get back to that one next time because I don't know if in fact, it is being used in a way. I'm sure these other companies are taking people's information too, and I'm just wondering how it's being used. And if it's being used for research, if it's being used for marketing, those are the type of things that I would like to look into a little bit more. But I can tell you that Verily has been a good partner with us in the fact that we've been able to move them around to the most vulnerable neighborhoods and allow for walk-ups even, that people who hadn't registered online or don't have access to online registration. That was a whole process that we put in place that I'm not sure is in place at other locations.
Thank you.
Okay.
At this time, there are no other raised hands and no other questions in the chat.
Okay. Everyone, thank you for being on. Hopefully you stay safe. We will see you in 2 weeks. Take care.